The vision for the knee care pain pathway was to bring the primary care physicians and us, the musculoskeletal team, which comprises of orthopaedic surgeons, anaesthetists, pain management consultants, my rheumatology colleagues, physiotherapists, to bring them together on the same table and discuss how to manage our patients appropriately, so that each knee pain condition could be assessed appropriately, examined properly, and sent to the appropriate person for treatment. And that would bring about a timely referral, a structured referral to the appropriate person, so that the correct treatment is done at the right time. And this would bring about a lot of patient satisfaction and bring down waiting times. My colleagues in my own department and in my other musculoskeletal medicine team, they are quite happy and pleased with the progress that we have made so far.
What have the GPs said about using the map and why it's been useful to them?
I think the most important issue is communication, because for years and years our GP colleagues do not exactly know what we want from them before referring a patient. And we often get letters from GPs, a brief letter about a patient's knee condition with no other appropriate information about the rest of the patient's medical conditions, or in fact even their knee condition is not appropriately explained. So what we would like from them is information of assessment, which would help us in deciding the appropriateness of the referral. And I think that is a very important understanding of the communication process that Mappa Medicine has initiated.
Are GPs finding that it's beneficial in cutting down the amount of time it's taking them to make these referrals?
Yes, it will cut down the journey that the patient takes from referral to treatment, because they will be hopefully assessed more appropriately. Hopefully they would be referred to the appropriate consultant of the musculoskeletal team, and hopefully patients would appreciate their condition a lot more even prior to referral, because all that information is already in the Mappa Medicine framework, which will be accessible to our GPs. So in that condition, a robust referral mechanism will help referral to treatment time.
As a management tool then, is the map useful?
I think so, because I think if we have a robust referral mechanism, then it will help in achieving the Access 2009 targets, and therefore from the management point of view, yes, it's going to be very useful.
Quite often speaking to health professionals, there is a different language between the clinicians and the deliverers of care and the management at the NHS. Do you think that the map in a way forms a bridge between those two groups and helps them to communicate what they need to achieve?
It's interesting you say that, and the answer to that question is yes, because they have been quite interested in how this is going on, and right from the chief executive level to our business manager, they are very interested to find out how this is progressing, because it will in the long term help in creating a bridge between the two. The whole Mappa Medicine is a dynamic process where we have put in as clinicians guidelines and protocols, assessment tools, which we have provided, or rather we could probably help our primary care physicians to gather and all that information before they're referred to the secondary care. And I think that's a useful tool which our managers are quite happy with in terms of reducing the waiting time targets. Of course, this process design will carry on and help us in the future.